Humans have a number of different blood groups. Of these, the best known are the ABO series and the RH factor. Before a blood transfusion occurs, it is important that the donor's and the recipient's blood are matched. Incompatibility of fetal and maternal blood groups can be a serious problem for the fetus.
Is there any relationship between the ABO and RH blood groups?
No, there's no relationship at all. The ABO blood group is a blood group in itself, and it has specific antigens on a red cell, usually A or B. The RH blood group is totally separate. It is a separate system altogether of antigens on red cells.
Okay, well, what is meant by the incompatibility of fetal and maternal blood?
When a woman is pregnant, there's a possibility of the fetal cells going into the mother and stimulating production of antibody. This antibody being developed in the baby can actually have a serious effect on this baby. It used to be called erythroblastosis fetalis, which is now called hemolytic disease of the newborn. So what it does is this antibody goes back into baby and actually destroys the red cells that are in that baby's circulation. When that baby is born, it is in serious trouble. What we're trying to do is we're trying to prevent the mother from producing that antibody. Okay, we do that by giving actually a suspension of antibody. This is anti-D, and it prevents the mother from developing the anti-D to start with. Now, this product is given throughout pregnancy so that the mother prevents this antibody from developing.
Okay.
Okay, that way you don't get hemolytic disease in the newborn.
Sensitization of an Rh-negative mother to an Rh-positive fetus is possible. Some of the Rh-positive antigens may enter the maternal circulation. They stimulate the mother's immune system to synthesize Rh antibodies against the fetal antigens. The most likely time for this to occur is close to birth. It takes the mother's system some time to build up a response to the foreign antigens. If it is the first Rh-positive child, then the child is not usually affected. However, if the sensitized mother is not treated, and she has a second child soon after that is Rh-positive, then her Rh antibodies may enter the fetal circulatory system. These antibodies will cause fetal red blood cells, or erythrocytes, to clump. This is a condition called erythroblastosis fetalis. Rh-negative mothers are now treated with a serum called RhoGAM. It blocks the mother's immune response to the Rh proteins and prevents sensitization.